Hi, everybody. I'm just opening up the doors for everybody to come on in. We'll begin promptly at 2 o'clock. So settle back. If you check your email, you will see the handouts available to you, and you can go ahead and download those through your email, or you'll see them inside the content windows in the webinar today. So we'll get into that in a few moments. Just give it another moment, and we'll go ahead and get started. Okay, well, hi everybody, and welcome to Operation Parents Webinar, Teen Addiction and Recovery. Today, our guest presenter is Samantha Murray. She's a therapist at the Morton Center. My name is Mary Beth Uberti, and I'm Operation Parents Director of Program Development. For those of you that may be new to Operation Parent, we are a parent-driven organization providing comprehensive prevention, education, and support resources for parents, caregivers, and organizations responsible for raising and guiding teens and preteens. Our webinars are just one of many ways we reach out to provide education on important topics. We are so happy to have you join us today for this 45-minute webinar. Before we get into the content, I am going to hand over the controls to Michelle Massey, who will be assisting me with today's webinar, and she will go over a few of the features of the GoToWebinar panel so you can fully participate in today's session. So just give me a minute. And okay, Michelle.
Good afternoon, everyone. As Mary Beth said, I'm Michelle Massey. I work on program development here at Operation Parents, and I'm also a parent of two awesome middle school girls. So I'm enjoying this work, and we're very excited to learn with you today. So I'm going to just go through a couple features of the technical side of the webinar today. First of all, on your webinar control panel, you will see an orange tab with an arrow. And this tab is on the top of your screen. It allows you to open and minimize your control panel. If you wish to view your screen without the control panel, just click on that orange tab and minimize it. For now, though, if you'll click on the orange tab with me and open up your control panel, we're going to view all of the features that we'll be using today, which there's just a couple. We're going to use the question feature, and all attendees will be muted during the presentation. We've already done that, but we would, however, like to hear from you via the question section. About halfway down the control panel, you'll see the question section. You will send both questions and comments here. If you're having any technical difficulties during today's webinar, I don't think you will, but if you do, feel free to let me know there. Now, there are three panels in this question section. The top panel will show you questions that you've already posted. Below that is another light blue panel where you can type your questions and send them to me privately. Now, let's try this. If you could send me your first name and where you're joining us from, make sure that you type send at the end when you're done typing your response. Hi, Autumn from Ohio. Tiffany, Kayla from Ohio as well. Maureen from Virginia. Hi, Betty from Las Vegas. Christy from Middletown. Maureen. Linda, Laura from New York. Vanessa from California. Hi, Anne from Crestwood. Lisa from Toledo. Christina from Washington, Donna from Florida, Wanda from Nebraska, Martina from Washington. Awesome. Well, we can see that that feature is working great. We still have a couple people logging in with us, but we've got great attendance from all over the United States today, and we are excited about that. Let me tell you just a little bit about your handouts. You've got 4 handouts loaded up in the system here. One is on teen and drug use statistics. The other one is titled, "My Teen is Using Drugs or Alcohol, What Can I Do?" The third one is resources for parents. And the last is a copy of today's presentation, which is titled Teen Addiction and Recovery. So that's a copy of the slides. If you could just double click on that handout to begin the download process. The handouts are available only while we're live today through the GoToWebinar system. Once the webinar has ended and the session has closed, you will not be able to download these handouts. We did, however, send you an email with the handouts attached about an hour prior to this presentation. So if you don't download the handouts during this live webinar, please check your email and you should see a copy there. We are recording this presentation, and this recording will be sent to you tomorrow afternoon. There will be a short survey also sent to you directly after the webinar. It will only take you about 2 minutes, and your feedback is invaluable to us as we continue to develop the webinar program. So at this point, those are our features in GoToWebinar, and I am very excited to turn it back to Samantha Mary from the Morton Center.
Hi, everyone. My name is Samantha Mary. I work at the Morton Center as a substance abuse and mental health therapist. I specialize in addiction, child and adolescence, women in addiction, and people with developmental disabilities. I've been working with children and adolescents for over a decade, which seems crazy how time flies. And I've been working with people with addiction since 2009. I've worked in a variety of settings, including crisis, outpatient, inpatient, and residential settings. So the Morton Center is a substance abuse outpatient clinic located in Louisville, Kentucky that has services for the whole family. We offer groups, individual, couple, and family sessions. Here, our main focus is really working on the whole person and the part of the system that they're in, which includes the family. We don't think addiction is a disease people fight on their own. So today's presentation, we'll learn about statistics on substance use, reasons teens use substances, what's the difference between addiction and experimentation, warning signs, steps parents can take if they suspect use, types of treatment, and then what does recovery look like for teens. So hopefully by the end of this presentation, you'll be able to identify most commonly abused drugs by teens, warning signs of addiction, steps parents can take to move teens towards recovery, and understanding treatment options that are available for teens. Because teens are facing more and more issues related to substance abuse. If you turned on the TV right now, I'm sure it would be very difficult to find a TV show that did not have something with alcohol or drugs being talked about or even shown. So alcohol is the most common used substance by teens. When it comes to illicit drugs, marijuana would be the first, then next would be amphetamines. When I say amphetamines, I'm talking about ADHD medications, typically like Adderall, Ritalin, or Vyvanse. I am not talking about methamphetamine. Though methamphetamine is a type of amphetamine, when we're looking at surveys, this is typically in its own category. The next for illicit drugs would include inhalants or other pills, such as opioids. We know drugs are becoming more and more of a reality because 1 in 2 seniors report that they've used a drug at some point in their lifetime. And 1 in 5 seniors report that they've used a drug other than marijuana in their life. So let's talk about the most commonly used drug by our teens, teenagers and alcohol. By 8th grade, 1 in 4 have reported that they have tried alcohol at least once in their lifetime. About 1 in 11 have reported that they've been drunk at least once. and 1 in 50 have been drunk in the past 30 days, which tell you probably about 1 in 50 are also reporting that they're current drinkers. 10th grade, by 10th grade, 1 in 4 have been drunk at least once in their life. About 1 in 11 have been drunk in the past 30 days. And about 1 in 3 report that they are current drinkers. By 12th grade, about 3 in 5 students have tried alcohol at least once. 1 in 3 are current drinkers. Nearly half have been drunk in their life, and about 1 in 5 have been drunk in the past 30 days. So like I said, marijuana is the most used illicit drug. It's also the most common mood-altering drug used on a daily basis. Alcohol is typically used on weekends, where marijuana is becoming more of a reality on a day-to-day basis. And it's actually found that marijuana is being used more on a daily basis than cigarettes in our adolescent population. With about 1 in 2 12th graders trying marijuana at least once, 1 in 3 10th graders, and about 1 in 7 8th graders at least once in their lifetime. About 1 in 17 seniors report that they use marijuana daily. And why is this a big deal? Because if we compared a 1975 joint to today's joint, the psychoactive ingredient in that, which is THC, it would be like smoking 17.5 joints in 1975 to 1 joint for today. So let's look at it a different way. In the 90s, about a joint contained about 4% THC. Today, it ranges between 15 to 30% THC. It's a huge difference. For a little bit of time, we saw a spike in synthetic marijuana. You might have been hearing this called K2 or spice. And this was becoming easily available in gas stations, being marketed as an incense. We've noticed that this has declined recently, and really rarely are teens using synthetic marijuana. A big part of that is because perception is huge, and they have seen or got the message that it can be dangerous. We are seeing different ways that teens are using marijuana, such as marijuana vaping. So you've probably heard or seen about cigarette vaping, and a lot of these machines can be changed to use oils with marijuana to vape. We also, you might hear about wax or dabbing, and this is highly concentrated amounts of THC. So like I said, in a typical joint, it's between 15 and 30% THC, where in wax, it's between 60 and 80% THC. There's also a myth that marijuana is not addictive, and this is false. Marijuana is psychologically and physically addictive. You might not see the withdrawal symptoms that you see in heroin or benzodiazepine or alcohol withdrawal, but there are symptoms of marijuana withdrawal as well. So why do teens use? Some teens use because it's a part of a social norm. We have this thought that we need to try now before becoming an adult. Our society also normalizes that it's a way of life to try things before we grow up or get out of college. And then there's also family social norms, where sometimes families approve of using substances in different situations, where the message is about how we use and when. Parents will also sometimes host parties. This isn't just like hosting a big get together and making sure you have the keys. It's allowing kids and their friends to use in the home, even if it's just a couple, to make sure they're safe. That's still hosting, and that's still letting your teen know that it's okay to use in my home. Sometimes teens also use to fit in with their peers. There's peer pressure, and fitting in with your peers is also a bonding experience. Even if one teen doesn't want to use, but someone else is, they're more likely to both use versus check it out and say, no, I don't want to use. Some teens use because they're bored. Other teens use to cope with depression, anxiety, or stress. Some teens use because of curiosity. A lot of times a type of drug is used based off of our perceived risk. And so the more perceived risk that a teen has, the less likely they are to use. And this is seen in studies with nicotine versus marijuana. Like I said, nicotine use has gone down, but marijuana use has gone up. And if you look at where our prevention commercials are coming from, we all know that nicotine isn't good for us. Smoking cigarettes is not good, but marijuana, we're saying it's okay in many ways. We also see teens using for weight loss or to sometimes gain muscle. This is a lot of times with steroid use. There's also a perception of enhancing an experience, trying to make things more fun, or we think we need to use because we're all getting together and that's what we see on TV, or that's what we see our parents doing. And then there's also genetics. So we know that when it comes to addiction, if we have family history of addiction, we're more likely to have an addiction ourselves if we choose to use. So how do we know if our kid is just experimenting because it's part of life, or if it's truly an addiction? So in experimentation, it's the first stage of drug use. So right before experimentation would be abstinence or no drug use at all. So experimentation means that they've tried the drug. Typically, this is out of curiosity. They've heard something about it. They wonder, what is it all about? Will this enhance my experience? With experimentation, they only try once or twice. And there's a level of caution. They're going to put safety measures in place, such as making sure that they're only with a couple of people, or they make sure they're not going to drive. The next level, after they've used once or twice, would be social use. And this is where we use in social settings. The most important aspect about social use is we know our limits and we're going to stop the use. So if mom and dad come home and say, hey, I'm not okay with you using, they're going to say, okay, I'm not using in the house. They know their limits and they're going to stop it as soon as they get some type of consequence. So it becomes problem use when all of a sudden that we see an increase in tolerance. Tolerance meaning they need more of the substance to get the same effect. They start developing a physical or psychological dependence, thinking that they need it to be able to get through something. Just because someone isn't using every day doesn't mean that it's not problem use or an addiction, because there's a pattern of use. So some people can go the whole week without using a drug, but then they find themselves every Friday and Saturday night binge using. There's also a compulsive nature to the use. And like I said, they use despite the consequences. So if they get in trouble at school or they get in trouble at home, they continue to use despite having that boundary set with them. So what are some warning signs to look for? You might see some mood changes, such as temper flare-ups, irritability, or becoming defensive. Some academic problems. This isn't just because they've been caught at school, but they might have poor attendance, low grades, or other disciplinary actions. You might see a change in their friendships, and a reluctance to have parents or family get to know their new friends, or parents for that matter. They have a nothing matters attitude. So all of a sudden, they're no longer interested in things that they used to love. And they just seem to have a general low energy. You start finding substances, drugs or alcohol, and paraphernalia in your youth's room or stuff. There might be some physical or mental changes, like memory lapses, poor concentration, lack of coordination, slurred speech, changes in the appetite. So you might start seeing some binge eating. You wake up the next morning, you see that the snack drawer has been raided. You might also see changes in their sleep, either a lot of sleep or not enough sleep. They might be blaming their allergies for their red eyes. You might start seeing that on social media stories that they have on their Instagram or Facebook, that they're glorifying use. They're posting more articles about pro-drug use or people using. You might notice that they wear cologne or perfume or smell like cigarette smoke to cover up other types of smoke that might be on them. You might notice clothing changes where they leave the house in one outfit, but they come back in another. You might find things in their room that make you wonder why it's there. Like, why is the spray can in their bedroom? Why is the air duster in the bathroom? You might find some empty punch-out medication wrappers, brown bags, eye droplets, things that make you wonder. They might start keeping their door locked, and overall, they're just becoming more secretive and closed off. So what can you do? The first thing you can do is stay calm, which is probably the most important and also probably the hardest thing to do. But your reaction can be the biggest factor in determining if your teenager successfully recovers, because the relationship that they have with you is going to be impact their ability to stay clean or let you know when they're struggling. Number 2, confront the issue. Addiction is progressive and will always get worse. Ignoring the problem does not make it go away. So though it might just be at an experimentation level right now, it can develop into a problem. And using to cope is never healthy, and it's important to have conversations about it. Number 3, part of addictive behavior is lying about it. Though it is important to have a conversation with your teen about their use and your values around drugs and alcohol, don't take your teenager's word for it. I've had a lot of teenagers say, well, it's Susie's. Don't listen to it. Talk to them about it, and don't listen to their promises, pleading, or threats that they might say to you. Number 4, set boundaries with your teen and do not give in. For instance, if you take away the car for a week, you have to be willing to drive them around and not make exceptions. Make consequences uncomfortable, but not unbearable, for you or for them, because taking away things that matter from them for up to 7 days is uncomfortable, but also realistic for the both of you. They will see that they can earn things back if they follow your rules. So cell phones, car privileges, favorite pair of jeans or shoes, makeup, and nail polish can be effective consequences for some teens. The most important thing is you need to know your teen and you need to know what motivates them. Number 5, learn as much about the disease of addiction and the drugs that your teen is using as you can. The more you learn, the more you'll understand what is helpful and what is hurting your teen in their recovery and what warning signs specifically to look for. Number 6, seek support. Addiction is bigger than your family and should not be kept a family secret. Getting help from professionals and support groups can help you, your family, and your teen in their recovery. Recovery programs for your teen should address addiction at multiple levels. So it should include areas such as family, mental health, medical, school, etc. The program should also offer services that are developmentally appropriate to your teen, as adult treatment needs are often different. Number 7, stay positive and patient with your teen and yourself. Addiction affects the whole family and can take its toll on everyone. If you feel anxious, depressed, or feel like you may have an addiction yourself, find help and support for yourself through a professional. It's also okay to take time for you and do your self-care, because you need to be at your healthiest in order to help your teen be at their healthiest. So let's say you've decided your kid needs some professional help. All professional help will start with an assessment. So what is an assessment? That's where you meet with a provider. You've probably filled out some paperwork, some background info on what the problem is, maybe some historical information about addictions in your family or mental health history. Then typically the provider will meet with the youth and the guardian separately for a bit of time and sometimes together. By the end of the assessment, they'll have come up with a diagnosis and then a recommendation. And the recommendation will always be the least restrictive that will meet the needs of the child. So the types of recommendations that you might hear would be outpatient. Outpatient is typically where you meet with a therapist once or twice a week for an hour. You go to a clinic, they take your child back, They have a discussion, and then you're done with that 1 hour. The next level would be intensive outpatient. And this typically consists of groups and individual sessions. For teens, this is typically after school hours. The next, and up to, it could be anywhere between 12 to 15 hours a week. 3 hours a group is the typical number. It would be after school. Then there's day treatment. And day treatment typically consists of group, individual, and also has a school component. Here, your kid is there for every day, 5 days a week, working on recovery, sobriety, and also that school setting. You might also hear partial hospitalization. This is day treatment. The biggest difference between these, because they can be used interchangeably, is partial hospitalization is always in a hospital setting, and partial hospitalization will have medical staff as well. Day treatment might have access to a psychiatrist and other medical staff, but the partial hospitalization will have them on site. Then finally, the most restrictive is residential. And this is where a child will stay for 24 hours a day. You might hear this, the 28 days or 30-day programming, where they often will have groups, school, and individual sessions at a high intensity level. I also want to talk about sometimes with different types of treatment, especially for adolescents, you might hear the word contingency management. And this is where there are rewards for positive behavior. So we're reinforcing the behaviors we want to see out of the kid. And this can be sometimes hard for parents to be like, well, why are we rewarding my child for behavior they should already have? And if we think about this, this is like you going to work for your paycheck, right? That would be an example of contingency management. You do a good job, you get paid at the end of the week. And so it's a way to shape behavior that we want to see in the future. So what questions can you ask as a parent? First thing is you need to know your state laws and what information can be shared. I've worked in 3 different states around the country, and the state laws have been different in each one with what information can be shared and when it can be shared, what age. So also understand what your insurance covers. Find out what is in network and what will be covered. Will over 30 days be covered? Will 20 sessions be covered? Will your drug screens be covered? It's also okay to ask the place that you're going to what is included in the drug screens, because when you start looking at synthetic drugs and more of the adolescent typical drugs, it can get more and more expensive. So it's good to know, what am I going to be paying for? Know what is the extent of family involvement. Family is key in change for an adolescent. And so it's important to know what are you expected to do and what is also available for you to participate. Can you come to family counseling? Do they have separate sessions for family members to be able to ask about their concerns or learn more about addiction? Know how will this impact my teen's education? This is a big deal for teens to leave school or do something after school that is not part of their typical routine. And so knowing how will it impact and how can I get my teen to their goals is important too. I think it's always good to remember, what will it look like if I don't get my teen help now? Will they actually get to their goals, or will this, if they continue to use, will this interfere with it? Know what information will they tell you about your child's use. So like I said, there are state laws that say what information can be shared and what information does not have to be shared. So typically, like diagnoses has to be shared, but the counselor does not have to tell you when they start to use. This can be difficult for parents to sometimes understand, like, why can I not know everything that my kid has gone through? But it's also important to start building a relationship with the counselor and the adolescent, as well as the adolescent and the parent trust too. So knowing how Information will be shared with you, and when it will be shared can put you at ease as well. You can ask, what is their experience with teenagers? Do they have a different program for teens than adults? And if they don't, are you okay with your 16-year-old being in groups with 30-year-olds or not? Are they trauma informed? So trauma informed is kind of a buzzword in the counseling world. And it's important for you to know that this is not a specific technique. It's an approach of how care is provided. So you might hear some specific trauma techniques that they might use. A big one is TFCBT, so that stands for Trauma-Focused Cognitive Behavior Therapy. But that is just a specific technique. They are not necessarily trauma-informed. So being trauma-informed means that they set up safety measures, because people need to feel safe to open up so they are not re-traumatized. So this might be telling the client why we're asking sensitive information about them. There's also a portion of trauma-informed care that focuses on strengths rather than pathology, where they're empowering the client to take the next steps, looking at the problem behavior as a symptom of trauma and needs new ways to cope with their pain. And being trauma-informed also means that there's collaboration with all parties, meaning that there's going to be collaboration with the teen and the counselor and family. At some level, should also be educated about trauma, so you understand what's going on. And then finally, another question you can ask is, how do they keep my teen accountable? What happens if my teen has a positive drug screen? Will they get discharged? Will there be a consequence of some sort? Am I responsible for the consequence? What does that look like, and how they're going to keep your teen accountable? So like I said, addiction does not just affect the teen, it affects everyone. And so support groups can help. There are support groups for everyone in the family. So there are family support groups such as Al-Anon, Nar-Anon, or Alateen. Alateen is a group just for youth, ages 13 to 18 years old. Then there's also 12-step meetings for the teen themselves or person in recovery. These are things like AA, Alcoholics Anonymous, or Narcotics Anonymous, where they work a 12-step program and typically will have a sponsor. It's okay to know who your sponsor is for your teen as well. Then there's closed versus open groups. The biggest thing here to know for parents is that a closed group means that only those who identify as being an addict can attend them, where open groups mean anyone can attend those. So as a loved one, you can go to an open group with your child. Then some other types of support groups is Smart Recovery and then Refuge Recovery. And Refuge Recovery is a mindfulness-based program. Smart Recovery is more of a scientific thought process behind it, where it takes out more of the spiritual aspects of what recovery looks like. Then there's also some support groups around the nation. We have one here at the Morton Center, which is called Concerned Persons Program. And this is where people who are concerned about loved ones in the community can come in and learn more about alcohol and drug use problems, such as what is codependency, what is it, how am I enabling my teen, what is healthy communication, how do I set boundaries, and what is substance abuse? What does that look like? Signs and symptoms. There's some information about ours if you're interested, or in the Louisville area. So finally, recovery can look different for everyone. And recovery is possible because youth are resilient and they do change their lives. When teens complete programs in their full capacity successfully, there's a significant improvement in use patterns. Some studies show up to 71% of teens who complete programs have not stopped their program because of insurance or because parents have pulled them, that up to 71% will improve their use patterns. This does not necessarily mean abstinence, but they have changed how they use, the frequency of their use, and probably what they're using. Motivation is also highest for sobriety while they're engaged in treatment. So the longer that they're involved in some type of treatment, the better outcomes that we see. So often for recovery, which is hard work, not just for the youth, but for the whole family, that they are often attending support groups. They're engaged in pro-social activities. They're honest, open, and willing. So what I mean by that is there are a lot of changes teens have to go through. So you've just asked a teen to stop hanging out with most of their friends, most likely because most of their friends were using, or they changed their friendship circle, and so the friends that they used to have no longer want to hang out with them. And so where are they going to sit at lunch now when they've come back? And they can feel very alone. So having those honest and open conversations about what am I struggling with right now can be very effective, and asking questions like, hey, and instead of saying, hey, how was school today? Actually sitting down and being like, what was the hardest thing for you at school today? What's the best thing that happened today? And that they're open and willing to have that conversation with you. And they're able to identify their emotions. They're able to utilize coping skills effectively. They communicate effectively with others. So they're using more assertive types of language, like I feel sad because Susie didn't want to sit with me at lunch today, and I know I really hurt her. They're able to set healthy boundaries with others, and they understand what a healthy relationship is and how to get one. So the most successful and hopeful cases that I have seen include when the whole family is open to making changes as well. It's not just the teen making changes in their life. So sometimes I see this being done because there's no alcohol in the house anymore, where the parents and the siblings have engaged in therapy as well, and that they're willing to make changes in their communication styles and how they interact with one another, and sit down and have dinner together, or do things that are fun and not always just talking about the drugs and what their worries are for the future. So thank you. I've really appreciated you taking the time out of your day to listen to me. And now I think I hand it back to Mary Beth.
Yes, you do. Hey, thank you so much, Sam, for doing that presentation. And I just want to encourage, if you have any questions, go ahead and send them in right now. I'm going to go over a few of additional slides just to talk about some of the offerings that Operation Parent has. It gives you a little bit more time if we have any questions. So we just encourage you to stay informed through Operation Parent. You can follow us on Facebook, Instagram, and Twitter. If you have not signed up for our monthly e-newsletter, you can go to our website and do that there. Once a month, we send out an e-newsletter about one particular topic. It can be anything from the digital world, drugs, alcohol, mental health issues, and it'll provide you with some information, articles, and links to more information and places to go for help. Purchase a parent handbook, I'll talk about that in a moment, and sign up for our future webinars, and host a community presentation. I travel throughout Kentucky and across the United States to do community presentations to parents. So if that is something that you are interested in, please definitely fill out our survey at the end, and you can request more information there. Our next webinar is going to be on e-cigarettes in teens, vaping, puffing, and dripping, on August 27th, which is a Monday at 10 a.m. with Dr. Patricia Purcell, and she is a pediatrician as well as the president of the Kentucky chapter of American Academy of Pediatrics. If you wish to attend this webinar, go to operationparent.org and register there. Just FYI, we have changed our website. It's brand new. So when you go to our website to register for this, go to the home page and go all the way to the bottom. You will see on the right-hand side a box that talks about our webinars. You can register right there. Handbooks can be purchased through our website. We have an English, Christian, and Spanish edition for the elementary and also for middle and high school. And you can place bulk orders online now too. This is just some of the content we cover in our middle school and high school handbooks, trends, misconceptions, warning sign. Each page provides great information on all these different topics. And then information on our community presentations. As I mentioned, I've gone all over, presented to over 19,000 people in the past 7 years. So with that, I'm going to just bring Michelle in. I'm not sure, do we have any questions, Michelle?
We do have a couple, and we've got time for more if anyone would like to submit one. Sam, our first, well, Mary Beth, actually this one's directed towards you. Is Operation Parent in North Carolina?
No, it is not, but we do sell handbooks across the country, and if you're interested in having a presentation, you can always contact me. But we also have webinars, and feel free to send these out to your community. When we're hosting a webinar, these are free, and we just encourage you, go ahead and send them out. You will also find some of our recorded webinars that we have done in the past on our website now. And please feel free to encourage your families, if you're in a coalition, to go on to our website and listen, order a handbook. But we are launching something called 21st Century Prevention with a local school district here in Kentucky, where it'll involve handbooks, our parent handbooks, and also videos that we're creating specifically for targeted to parents, caregivers in 4th grade. So this is a launch of a new way to educate parents and reach them differently than we have been in the past. So as that rolls through the year, hopefully that'll be something we'll be offering across the country.
Okay, Mary Beth, the next question is, will this webinar be available on your website and how soon?
Okay, for those of you attending, whether you're live tomorrow, you will be receiving an email from us that will have a thank you note. It will also have a link to this recording, as well as a link to the survey. So if you're staying on to the very end today, you will get the survey immediately. But if you missed that, their survey will show up tomorrow. So anyone, obviously, who is not attending, they will also get the recording. So anytime we host a webinar, I just encourage you to please go ahead and register whether you can attend live or not, because once you're registered, you'll receive the recording. As we fix up these webinar recordings, they will show up on our website. So if you go to our website right now, I believe it's under resources, you will see past recordings that we have out there.
Okay, the last is the comment, and it said, thanks, Sam and Operation Parent. Keep up the good work.
Thank you.
All right. Okay, if anybody has any last questions, once I shut this down, this is your last chance to get the questions in. We'll just wait for a moment. Sam, is there any comments that you want to make or something that you wanted to cover that maybe you just want to explain a little bit further?
I think it's important to know that though recovery is really difficult for anyone. It can be especially difficult for teens because of all the changes they're going through. But knowing that teens' brains are not also fully developed, and so they are making changes all the time, and they can lead successful lives. And it is important to be patient with them as they're figuring out who they really are as an individual through all of the social media and through different pressures that they're getting. And it's wonderful to be to see them explore who they are and change their lives for the better.
You know what, Sam, I do have a question, because we get a lot of phone calls from parents who are saying, well, I found this or that drug or alcohol, and, you know, it's just a rite of passage, right? Should I just, you know, that's what we get. So I'm just curious, what do you say as a therapist to parents when they question that?
So like I said, part of it is our society norm says, hey, it's okay that you drink. It's part of the college experience. It's part of you being a senior in high school. And the reality is, though, yes, 1 and 2 have tried a substance at one part of their life, that does not mean the majority are, and not all of them are. So it doesn't have to be a norm. And I think a lot of times that's something that makes us feel better about maybe something that we've done. But it's important to have the conversation with, why are they using? because that's going to give you a lot more information about is it just experimentation or has it been a problem? Because if your child is using in isolation, they're coping with something, and that's not healthy. If they're using every day, that's not healthy. If they're using every weekend, that's probably not healthy. So is it a rite of passage? I don't necessarily think so. I think curiosity is part of teenage behavior, and in some ways it's part of adult behavior, but the more that we understand where they're coming from, the less likely it's going to develop into a major problem later. Having that open communication with parents is key for prevention. Does that answer your question?
Yes, it does. And something to keep in mind too, parents that are listening, is providing alcohol or any form of drugs, illicit drugs, to your child, whether it's inside your home or like, I'm going to have a party, I'm going to keep everybody safe and collect the keys. It's illegal. It's there are keg laws. You hear all different wording for the law itself, but it is illegal, and it's even illegal in some states whether you know that substance is in your house or not. So if you have a few kids over and somebody is coming in through the back door sneaking in alcohol or drugs, and somebody else calls the police, you are legally responsible for what occurs in your house, whether you are aware of it or not. So something to keep in mind is when your kids are saying, you know, it's no big deal, so-and-so, you know, why can't we just have alcohol? We'll just do it here. You're legally responsible. So, you know, just stick to that. I'm sorry, you're not 21, or I'm sorry, it's an illicit drug. It's not going to happen. And make sure if you are having a group of kids over to your house, it is very, very clear that it's not allowed, and make it very clear to your child that it can put you in legal jeopardy if somebody brings it into your house without your knowledge. Just FYI. Okay.
Mhm.
All right. Well, we're going to,
We have one.
oh, wait, sorry.
We have one closing question, which is a really good one. It goes right along with what you guys are discussing. How are young teens getting access to drugs, and how are they so easily obtaining drugs and alcohol?
So it kind of depends on the drug. Alcohol, I'm still hearing a lot of like, I get it from my parents' cabinets, or like, you know, mixing it with other things, or they have an older sibling or someone that's over 21 that doesn't think it's a big deal, that will buy it for them. Especially when you're talking to 17 or 18-year-olds who are friends with people that were older than them when they were in high school together. So alcohol and drugs really has no bounds. And so if someone is willing to get it, they will find a way. And a lot of times teens are buying from other teens in their schools. People get a reputation and they're able to find it in different ways. So marijuana is the most easily obtainable illegal drug at this moment in time. I also hear from my teens that it's easier to get marijuana than it is to get alcohol, because parents are becoming more and more aware of like what's in their cabinets and not. So it's kind of a tough question to know exactly where they're getting it from, but a lot of times they're finding it in the schools, or not necessarily in the schools, but they're finding it from their peers who are getting it from dealers in other ways that they're connected to.
Okay. All right. Well, we're going to go ahead and end the webinar at this point. Thank you so much, Sam, for sharing all this wonderful information. And then just as I mentioned, once I shut this down, handouts will be only available through that email. And then you can, you'll receive the survey. I appreciate everybody coming here today and for the wonderful information, valuable information you shared today. Thank you.
Thank you.